I think just having a pharmacist in the clinic to try and help and, like I said, be readily available for any side effects, trouble obtaining the medication, anything like that, and helping out the insurance is a big thing. We also have our own specialty pharmacy now at UC Davis, and what that means is that a lot of these multiple sclerosis medications have to be filled at specific specialty pharmacies, and now we can fill a lot of those here. And what helps with that is that my technician actually makes all of the calls every month to remind patients that they're due for their refill. And we actually we did a study at UC Davis with the pharmacy team that showed there was actually an improvement in medication adherence once we started to have, this specialty pharmacy and a pharmacist and the pharmacy technician directly working with it, and specifically working with these multiple sclerosis patients. I think, more personalized care, somebody actually reminding them when they're due for a refill, and then a lot of times when they fill at outside pharmacies, issues will come up where insurance companies will need a reauthorization every year, or for some reason, a prescription is sent for a refill request to the pharmacy or to the clinic, and somehow that paperwork doesn't get complete. And then the patient sometimes will not call the clinic to say, I'm out of refills, and it kind of just falls to the side. So being able to be there and have that specialty pharmacy directly there keeping track of everything, I think helps a lot with that, because then if an authorization issue comes up or if there's any issues of needing a new prescription, I'm right there, and the neurology clinic is right there, so it's very easy for me to go to Dr. Apperson and say, we need to do this or that, or for my technician to know about the need for the authorization right away and be able to work on it. I think, showing things like this improvement in adherence and showing things, in different interventions that pharmacists can make and showing how it can work well in the clinic, I think that can give, hospitals an idea of ways that pharmacy can certainly help by incorporating into the clinic. It's still a relatively new thing for a pharmacist to be actually directly in the clinic. Where I did my residency, it was kind of a unique situation where they've already actually progressed pretty far at pharmacy there, and they have pharmacists in almost all their clinics, so I was able to get good exposure with that and then bring that to UC Davis. So I feel like if ever programs see how well it can work, in terms of, patient care, hopefully that'll help out. Well, I think overall I've only had positive experiences with patients, and a lot of it is because I was telling you about is the fact that I tend to be very readily available, so they have my phone number, and I think it can help for a lot of them to be able to know that if they dial that line, they're going to have somebody right there that can help with side effects right away, help with any insurance issues and other types of problems. So I think it's just nice for a lot of them to have another person there, or if they forget about the side effects of the medication and they just want somebody to speak to, I think that helps a lot. And then, like I said, I also do follow-up phone calls with them to make sure that things are going well. And a lot of times I think, if somebody doesn't have somebody directly reaching out to them, that even if they have an issue, they won't necessarily take the next step of calling the clinic. So I definitely have different ways that I organize things, especially depending on the patient. So for example, with the medication Limtrada, there's a lot of lab work that goes into it. So I've actually built my own secure Excel sheets, and I just keep track of everything there. Same for getting patients, the requirements done for Gilenya. Once again, kind of having these Excel sheets to help keep myself organized, and I have a calendar in which I keep track of phone calls and who I need to reach out to and things like that. So definitely just trying to stay organized and on top of it.